day everyone, I am Maple K. Mukamad, a student nurse from Davao Doctors College. And for today's video, I am going to show you the bag technique and the materials inside the bag that we're going to use during the home visit or during the community. But before that, let me just give a short introduction of what this bag technique means and what is it for. So the meaning of the bag technique and its purpose also. And what are the materials that we'll be needing to put inside the bag. What is bag technique? So bag technique, it is a tool by which the nurse during her home visit will enable her or him to perform a nursing procedure with ease and deftness. It also an essential and indispensable equipment of a public health nurse, which she has to carry along during her home visit. So this is also to save time and effort with the view of rendering effective nursing care to the clients. So now let's move on to the common materials. So let me show you what are the materials needed for this procedure. But some of these are not present, but let's assume that I have it all. So first is the linen or paper towel, sanitizer, apron, measuring tape, soap and soap dish, test tube holder, thermometer, glucometer, weighing scale, medicine dropper, alcohol lamp, cotton balls, kidney basin, straight forceps, surgical gloves, cotton tip applicator, adhesive tapes, and bandage scissor, syringe 2 ml and 5 ml, and the last is the cord clamp. So these are the materials that we'll be needing in the community or the home visit. So I'm going to show you what are the some of materials that I have it now. So now I am going to show you by each material that I have it now. So first is the alcohol, 70% alcohol, the surgical gloves, the tape or the adhesive tape, and then the kidney basin, the syringe, the bandage, the thermometer, the measuring tape, and the forceps. Also, I have it stethoscope and the BP apparatus. So let's proceed to the next procedure. So there is actually a content and proper arrangement of the materials inside the bag. So first, in the front of the bag left to the right is the thermometers in case. So we have thermometer, 2 pieces of thermometer, which is one for the oral and other one is for the rectal. And then the tape measure, adhesive plaster, and the cotton applicator. And then second, on the right rear of the bag, we have 2 test tubes and 1 holder, then the medicine dropper and the alcohol lamp. So for the third, on the left rear of the bag is the medicine glass, baby scale, bandage scissors, and the rubber suction. So for the fourth step, at the back of the left right are the 70% alcohol, betadine solution, hydrogen peroxide, terramycin ophthalmic ointment, heparin solution, spirit of ammonia, acetic acid, Benedict solution, liquid soap, and the cotton in the sterile water. And next is into the center of the bag. We have 2 pairs of forceps, the curved forceps and the straight forceps, 1 surgical scissor, and sterile dressing, oxygen saturation, and the cotton ball, and the roller bandage, the syringe, hypodermic needles, sterile cord clamp, kidney basin. So for the next, on the top pile of the bag, of the center of the bag is the hand towel in the plastic bag, so soap in soap dish, apron, and the plastic linen lining. So for the last, and the pocket of the bag, for the pocket of the bag, are the surgical gloves and the waste receptacle, But take note, folded paper lining inserted between the flaps and the cover of the bag. Also, the BP apparatus and the stethoscope are carried separately. So that's all. Let's proceed to the next. So these are the principles to consider in the use of the bag. So first, the bag should contain all necessary articles, supplies, and equipment which may be used to answer emergency needs. And second, the bag and its contents should be cleaned as often as possible. Supplies are replaced as necessary. And the bag and its contents are ready for use at any time. And third, the bag and its contents should be well protected from contact with any article in the home of patients. Consider the bag and its contents clean and or sterile, while any particles belonging to the patient as dirty and contaminated. And for the fourth, the arrangement of the contents of the bag should be convenient to the user to facilitate efficiency and avoid confusion. And then frequent hand washing should be done to help minimize or avoid contamination of the bag or its content, or this to prevent the spread of microorganisms. So when the bag is used for a communicable cases, it should be thoroughly cleaned and disinfected before keeping and reusing. So since we are not able to do an actual home visit due to this pandemic, I will just explain briefly what is home visit. So home visit is a professional face-to-face contact made by a nurse to the client or the family to provide necessary healthcare activities and to further attain an objective of the health agency. So first, we have if we going to home visit, first this is to give nursing care to the sick, to a postpartum mother and newborn, and then to find out home living conditions of the client and family in order to fit a health teaching needs, and then to teach health practices, prevention of disease, and correction of defect for better living. So also to detect, help prevent spread of communicable diseases, and then to establish close relationship between the health agency and the public for the promotion of public health. And for the last, to make use of the referral system and use of community services. So I will show you how to put the materials in the bag. So now I am going to show to you how to put all the materials into the bag. So first, we need to sanitize our hand to prevent the spread of microorganisms. Now I am done showing all of you the bag technique. Again, I am Maple K. Mukamad from Group 35. Thank you!